Welcome to More Than Medicine, the podcast from Zeam Health. This show explores how integrated psychiatry, primary care, and aesthetics come together to support the whole person, not just isolated symptoms. Each episode is grounded in clinical insight, real-world care, and the latest research, helping you better understand your health and the options available to you. Whether you're navigating mental health, managing a chronic condition, or thinking about preventive or aesthetic care, this is where medicine connects. Let's get started.
If you're considering ketamine therapy for depression, one of the first questions you probably have is this: what is it actually going to feel like? Not just the benefits, but the experience. The side effects. The safety. What happens during the session and after? Today, we're going to walk through what patients should realistically expect from ketamine therapy, how side effects are monitored, and how a professional clinical setting keeps treatment structured and safe. Ketamine treatment has gained attention because it can help people who haven't improved with traditional depression treatments. For many patients, it represents a new path forward. But new treatments naturally come with new questions, and sometimes anxiety about the unknown. Here's the important frame. Most ketamine therapy side effects are temporary, expected, and medically monitored. Understanding them ahead of time reduces fear and increases confidence. During ketamine infusion therapy, most patients notice sensations that feel unusual but short-lived. The most commonly reported effect is something called dissociation. Patients often describe it as feeling detached, drifting, a soft change in time perception, or observing thoughts from a distance. Not everyone experiences it, but when it happens, clinics expect it and monitor closely. Some patients also notice light dizziness, floating sensations, or sedation. And that's actually why treatment is done in a supervised setting with patients reclined, supported, and continuously observed. This is not a take-it-and-go-home treatment. It is structured medical care. After a ketamine session ends, most side effects fade within a short window. But many patients feel tired or mentally foggy for a few hours. Common short-term effects can include sleepiness, mild nausea, headache, a floaty feeling, slowed thinking. Because of this, ketamine clinics require a ride home, no driving afterward, and a low-demand day following treatment. This is planned, not unexpected. You are never discharged until medically stable. One of the biggest misconceptions about ketamine therapy is that it's loosely supervised. In reality, it's one of the most closely monitored outpatient psychiatric treatments. Before treatment even starts, clinicians screen for heart conditions, blood pressure risks, medication conflicts, medical contraindications. During the session, staff monitor blood pressure, heart rate, breathing, oxygen levels, comfort level. Blood pressure is typically checked before dosing and again around 40 minutes after, because temporary increases are common and expected. If anything looks off, dosing can be slowed or paused immediately. This is active monitoring, not passive observation. Some patients worry about long-term risks they've seen mentioned online, especially bladder issues. Here's the clinical reality. Those risks are associated with chronic high-dose recreational misuse, not medically supervised ketamine therapy. Clinical dosing is lower, spaced out, medically guided, and monitored. Different pattern, different risk profile. Still, not everyone is a candidate. People with uncontrolled hypertension or certain cardiac conditions may need alternative approaches, which is exactly why medical screening happens first. Not every patient experiences the same side effects. Some experience several. Some experience almost none. That variability is normal. The key takeaway is this: side effects are usually temporary. Therapeutic benefits develop more gradually. Ketamine therapy is not about a single session. It's about a monitored treatment series designed for longer-term stability. If you're exploring ketamine treatment for depression in Sacramento, Folsom, or Roseville, having a structured, medically supervised setting makes all the difference. At Zeam Health and Wellness, ketamine therapy is delivered with medical screening, continuous monitoring, safety protocols, and personalized treatment planning. If you're considering ketamine therapy and want clarity about whether it fits your situation, the best next step is a clinical evaluation and conversation. Support, safety, and transparency come first. In our next episode, we'll shift into psychotherapy and answer a question many patients ask early on. What's the difference between cognitive behavioral therapy and psychodynamic therapy, and how do clinicians decide which one is right for you? Until next time, take care of your mind, your body, and your whole health.
Thanks for listening to More Than Medicine. If today's episode sparked questions about your own health or helped you understand your options more clearly, you're not alone. At Zeam Health, we provide integrated psychiatry, primary care, and aesthetic services designed to support your long-term well-being. To learn more or schedule a visit, head to zeamhealth.com. We'll be back soon with another conversation focused on care that goes beyond the surface.